We are often approached, and increasingly so, by individuals regarding the question of whether continuing healthcare funding meets the cost of care in full. Now, unfortunately, we have heard instances of people being informed that there is a limit on what costs the continuing healthcare funding team within the NHS, within any particular area, will pay. We can clarify that that is simply incorrect. The national framework is very clear that where somebody's needs are primarily health needs and they are entitled to continuing healthcare funding, the cost of their care must be met in full by the NHS. In no way, shape or form is it in any way means tested, so it's utterly irrelevant whether the individual has a property or funds exceeding the local authority funding means tested threshold. That does not come into it. It's a continuing healthcare funding entitlement and the costs must be met in full by the NHS. Now, by way of a working example, we have heard from people who have been told that the most the NHS will pay in any particular area is a set level, by way of example, £600 a week. Now, if all the care homes in that area are charging £800 a week, clearly there would be a shortfall, and that is not appropriate. And there is no provision within the national framework to allow for a top-up fee, which is the terminology utilised where there is a shortfall at the local authority funding level. That same process and situation cannot occur at NHS continuing healthcare funding. It's entirely different, and it specifically excludes an individual from paying any top-up process between the difference the NHS will pay and what a particular home is charging. Now, this is something that is obviously extremely problematic, but in no way, shape or form should in fact impact on the patient in any way. The nursing home may, as a business, have made a business decision with the NHS to accept a lower rate than what they would ordinarily charge a privately paying individual. For example, it might be the case that the NHS has 10 patients in that particular home, so they're able to negotiate on an economies of scale basis a discounted rate. That is a matter between the home and the NHS and does not affect the individual, and the home cannot ask the individual to meet the difference in costs. So once again, the continuing healthcare funding that an individual is provided should meet the cost of care for that particular individual, whatever that cost is. Now, this will entirely depend on what the needs of the individual are. You may have someone who it requires 24/7 one-on-one care. Clearly, in those circumstances, their care costs will be far higher than somebody who still has primary health needs but does not require the same level of one-to-one care. This is down to the individual package that must be calculated and considered by the NHS in conjunction with the patient to ascertain what their care needs are. But once again, once that has been established, the NHS are obligated to meet the costs in full. Now, this is a working example of the sort of misinformation and incorrect details that are provided to people around the whole topic of continuing healthcare funding and their entitlement to it. We are, as I say, frequently approached with this sort of scenario, as well as people being incorrectly denied the funding they should be receiving. All I would say is that if you have any questions or queries or any concerns in relation to a relative's entitlement or not to continuing healthcare funding, you should not hesitate to contact us directly to speak with, in the first instance, with one of our expert advisors. There is absolutely no charge and no obligation in doing this, and all of the information you provide us is strictly confidential. We can be contacted by telephone on 0121 227 8940. Alternatively, you may find the video blogs on our website a useful source of information in the first instance via our website at www.continuing-healthcare.co.uk. Once on the website, there is an assessment form that you can complete, and one of our expert advisors will be in touch in due course to go through matters with you. Thank you.